Good morning. I'm Dr. Dale Dangleben on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel. This is your daily medical tidbit. Today I want to talk about leg and ankle swelling, okay, called edema. That is also called peripheral edema. If the doctor says that, then now you know what it means. It's a very common complaint in medicine, right? And it can be benign, all right? So, but it can also be a serious marker of underlying problems, okay? So the doctor has to distinguish between the harmless causes and those that require semi-urgent or urgent intervention, all right? So how does this happen? How does this, is swelling, edema, I'll use these terms, right? Same thing, occurs when the fluid leaks out of your blood vessels into the surrounding tissue, all right? And we're not going to get into the basic science of it, but there are different pressures, right? There's what's called the oncotic pressure, which is pressure driven by the amount of protein, and if that is low, then you have liver disease, kidney disease, then you could have swelling. It could also be driven by something called hydrostatic pressure, which you see in obstruction of your veins or in heart failure, right? You could also have obstruction of your lymphatics, your lymph vessels, that brings lymph that fights infection. You see that with what's called lymphedema, right? I'm sure some of you have heard that term, or even in certain, cancers. Okay, so let's get into the causes. So from a heart standpoint, congestive heart failure, that is pooling of the blood pools, right? Due to poor pumping of the heart. All right, so it's stagnant. All right, and what do you see with congestive heart failure? You see bilateral swelling. Okay, and it gets worse at night, and also shortness of breath. Also is a finding that goes with that. Another system that could be affected is the kidneys, right? Something called nephrotic syndrome, right? And chronic kidney disease. You have a large amount of protein loss, and you have the low oncotic pressure that I talked about. And you get generalized edema, swelling all over. You also get the puffiness around the eyes. I have some of that, but that's just from me being tired. And also continuous frothy urine. Like when you pee and you see it just foaming, right? That's a sign, all right? Next is the liver, right? You can see it in cirrhosis or chronic liver disease because your albumin level, which I've talked about in previous lecture, which is a protein, is low, okay? So you have ascites, which is a fluid buildup in the belly. You have the spider angiomas that I talked about yesterday, and you have the yellowing of the skin. The vascular system, which is the blood vessel system, you can have a deep vein thrombosis, but usually that presents as one-sided swelling. Okay, not the both sides. So what's called unilateral. All right, and with DVT you can get pain, you can get erythema, which is redness. All right, and not just the deep vein thrombosis, but also if you have chronic venous insufficiency. Right, that's long-standing swelling, the darkening of the skin, the ulceration of the skin, secondary to vein problems. Next system is the lymphatics. You have lymphedema, which is firm, and when you push on it, it doesn't really indent, right? That can be congenital. It can be due to cancer or other issues, but not due to people doing you bad, like we say back home. And there's certain medications. I highlighted that before in the past. The calcium channel blockers like Norvasc, the amlodipines, right? The non-steroidals, some steroids can cause leg swelling also. So as you can see, the list goes on and on and on in terms of ankle swelling, right? So the physician that is seeing you has to, ask you about the onset. Was it sudden? Is it gradual, right? Is it one-sided? Is it both sides? Is it right, meaning bilateral, right? Is there associated symptoms? Are you short of breath? Do you have chest pain? Do you have blood in your urine? Is your skin yellowing? All these questions are relevant in these settings. Obviously, going through the medication list, alcohol use, family history. That's what we have to do on our end. In terms of the physical exams, I've gone through it. You want to see, is it one-sided versus both side, right? Is it pitting, meaning that when you push, does it stay indented or does it not do that, right? Do you have the ascites, the spider angioma, the redness of the palm, right? And all these other things that goes along with it, right? And there's a whole slew of lab work that can be done while this investigation is being done. We're not going to get into the labs, but if you have a differential diagnosis, then the physician will go ahead and order the appropriate labs. It's also the radiographs, the x-rays, right? A chest x-ray is very important to see if you have fluid on the lungs, right, suggesting a congestive heart failure, and all these other studies that can be done. In terms of the management, compression stockings, right, which we do have at patient choice, elevation of your legs, reducing your salt intake, right, and stop or adjust your medications, having a discussion with your family physician about that, right? And then there's different medications that you can use, the Lasix, the water pills and things like that. And you can get more into that maybe at some other point, but there's a lot of things out there that can be done for lymphedema. We can do lymphedema massage. Nurse Kate is certified in lymphedema therapy, and these are things that we plan on doing at patient choice eventually. So again, just be cognizant of leg swelling and look out for the red flags. All right, the sudden swelling in one leg, you think deep vein thrombosis, a blood clot in the leg. All right, if you have swelling and you get chest pain and you're short of breath, you want to think of a blood clot to the lungs or congestive heart failure. All right, and all these other things that are important. So I want to just emphasize again, it's not just a cosmetic problem. Oh my God, I got swelling in my feet. It could be the first sign of heart failure, kidney failure, or liver disease. All right, so I just want to put that out there this morning. This is not meant, to have you paranoid. This is about educating you so we are better aware of our health as we move forward. Have a great day. Peace.